Hello, my name is Jess Adamson. Welcome to the Breakthrough podcast, brought to you by Breakthrough Mental Health Research Foundation, Australia's only dedicated mental health research organisation. In this series, we'll be talking to courageous people who share their personal stories about their lived experience of mental health issues. We'll also be talking to researchers in the field to get an understanding of the how and why of mental illness. Mental illness is going to be the biggest health challenge in our lifetime. It consumes lives, it ruins lives, it takes lives. But it's time the question was answered. Why does it happen? And more importantly, how can we stop it? If you find anything spoken about in today's episode distressing, please contact Mental Health Emergency on 131465. Professor Tracey Wade has worked as a clinician in the area of eating disorders for more than 30 years, and her current research interests are in the etiology, prevention and treatment of eating disorders, with a focus on implementing this research into real-world settings to improve outcomes in body image and eating disorders. Tracey, welcome to our podcast. I want to start by asking you about how common eating disorders are and how dangerous they can be.
Mm-hmm. Yeah, the prevalence of eating disorders has been a bit debated over time because they're actually a little bit hard to detect. And that's because when you ring people up out of the blue to do a survey and they say, "Are you too thin? Have you ever been too thin?" All the people with anorexia go, "No, I'm not thin enough yet." So it actually has been underdiagnosed, but certainly our statistics with Australian teenagers aged between 12 and 19 tell us that about 8% of those girls had an eating disorder by the time they were 19, different types of eating disorder, and up to 15% had problems with their eating such that it made them look impaired compared to the girls that hadn't had an eating disorder. And all eating disorders are serious. Most people fixate a little bit on anorexia nervosa. They think that's the one that will kill you. We actually know the mortality statistics are the same regardless of whether it's anorexia nervosa, bulimia nervosa or binge eating disorder. Mortality is elevated, and part of that elevation is because of suicide.
Mm. Has there been an acceleration in eating disorders with the explosion of social media?
There has been an increase in what we call disordered eating or disordered eating behaviours over the last 20 years. We know that's the case in Australia and also South Australia. And the reasons probably are multiple, but certainly social media and particularly the visual imagery and the comparisons that go on, particularly around appearance, the ability to change an appearance online is certainly something we know that really decreases people's satisfaction in how they look. And some research that we've just been doing lately would suggest that a platform like Instagram is particularly damaging because it's very much based around imagery. And so it's not so much about how much time you spend on social media, it's which platforms you're using and for what purpose you're using them.
Mm. We've heard Elise's very powerful story about her challenges with anorexia and the way she spoke about Rex, and she was able to draw him and describe how he spoke to her. Is that something that you've heard time and time again?
It is certainly part and parcel of the disorder. And people talk about the anorexia nervosa being a friend and talking about it being a best friend. And we actually often get clients to actually write a letter to anorexia nervosa as their friend, but also then a letter to their enemy, anorexia nervosa. Because what happens over time, it starts off as a friend and it increasingly starts to control the person. And when you look at the pictures that people draw and how they describe it, the friend is a very unpleasant person.
Mm.
It really reviles them, it calls them names, it says they're not working hard enough. It promises some good things in the future, but it says, well, where you are now is no good. And so it's all bad news. So the person ultimately starts to become ambivalent about this presence in their life. They can see that it's achieved something for them, but they can also see that it's starting to systematically destroy their life.
How important is research in our battle against eating disorders?
I think it's absolutely vital. And one of the reasons I say that, apart from being a researcher, is that it's been probably 20 years that I've been doing full-on research in this area. We have learnt so much and so many things have changed, and that includes treatments. And it includes our understanding of what causes eating disorders, which then affects treatment. So one example is that we used to blame families. We used to say that families caused an eating disorder because they were crazy. And we tried to remove the child from the family. And then we started to understand that, in fact, eating disorders run in families because of the genetics. It's not because of the family environment. Now, that actually is a message of hope, because that means environment can be changed, genes can then react differently. But you have to figure out, what needs to happen. And often it's about the families uniting, working together, and helping their child. So family is actually now part of the treatment for children and adolescents. So we've made a huge move, a huge shift in our understanding of the etiology, which has then informed the treatment. And we've become much better at treating eating disorders. We still have a long way to go, but we've already seen seismic shifts in 20 years, and that would not have happened without research, without evaluating. If we go on what people think works, if we go on what they think is best, if we go on their hunches, it inevitably leads us down a rabbit hole, which actually then can cause disaster for our the people out there that have eating disorders.
What can you tell us about the research that you're doing at the moment?
Yeah, we work on a number of levels. So we are doing some work on the genetics of eating disorders, but we're particularly interested in the epigenetic, which is how the environment can actually change the action of genes. So you may be genetically predisposed to getting an eating disorder, but there will be environments that protect you and that offset that risk. And we need to understand about what those specific environments are. And we know that one particular unhelpful environment is peer teasing about appearance. It's not actually the family. It's when kids reach adolescence and there's a lot of peer teasing, which can happen on social media or in person. So how do we help people protect themselves there? We're also working in the prevention space, and we're about to launch in the next few weeks our new online Media Smart program, which is for young people to help them to start to question the images they see in the media and to empower them to become critical observers and consumers of the media, such that it doesn't damage the way that they see themselves and their body satisfaction. We're also involved quite a lot in treatment, and that's where we've been very involved with the statewide eating disorder service. It's a great privilege for me to be involved in helping to set that up. And it's been lovely that the service has been so receptive to evidence base and to ongoing evaluation and to ongoing research to inform their practice so that they can be flexible. As I said, this is a field where things change quickly. There's no point in setting up a service and then just leaving it. It has to really understand what the new evidence is saying. It has to collect its own evidence, and it has to change its practice. It has to be incredibly flexible to do the best for people with eating disorders.
Can you tell us about SEDS, the statewide eating disorder service? What's your hope for the new centre?
Yeah, I hope it's a truly true integration of research and practice, and that they bounce off each other and they become, you won't be able to see the dividing line between the two, that the research informs the clinical practice informs the research. And these days, we're also very keen to have consumers and their families as part of telling us what they think works and what doesn't. And we talk now about research co-design. So I actually hope this is going to be a world best example. And I would like to think that people around the world will be talking about what we're doing here in South Australia, because it is cutting edge. It is starting to push the progress even more quickly in terms of what we understand about eating disorders and how best to treat them. And this new centre gives us a chance to have the research, the clinical services and the families and the people with eating disorders mingling such that we can truly help each other build that better future.
So all under one roof, learning from each other side by side, that is surely a world first.
I think it is going to be a world first in that it's going to be truly integrated, and I think because it'll be purpose-built. So we'll be building the centre around our needs, and we know what our needs are now. So we're in a very privileged state to be able to do that. And I think COVID has probably taught us, Zoom is okay, but there is absolutely nothing like face-to-face interaction in order to really be able to solve problems. So being under that one roof actually has that capacity for us to really get to grips with problems, discuss them, think about them, and work together to solve them.
Now, this centre that we know is going to be built at the old Repat Hospital at Door Park, what a great beacon of hope for South Australians, that there really is going to be a purpose-built facility, because for so long we've just heard people say there's nothing out there to help me.
Yeah, and that's, certainly that has been the case and was the case for a long time in South Australia. And as we were talking about, the services were a little bit scattered. And to have an actual physical presence, to have one website, one number, such that the presence becomes quite clear to the community and to GPs and to community mental health teams, so that when people start to talk about eating, they say, oh, I know where you should go. So there's no delays, there's no misdiagnosis, there's no saying, well, just wait and see, I think it's just a phase. Just let's go, let's get this assessed, let's see what's going on. And we know where to go now. And we actually have a critical mass of experts under the same roof. And we are sure that you will get help there.
How powerful are people like Elise in helping others realise that they can get through this?
I think Elise is extraordinary because, she has this wonderful story of 10 years of recovery. And she was talking about, though, that very slippery slope to recovery where she was sliding up and down that slope. And for the people that are in that process, it's very easy to give up hope and to think that recovery is not possible. And so to see someone who can say that it is possible, it wasn't easy, it took a long time, but it was possible, is truly inspirational. So I remember a client that we saw about 2 or 3 years ago. She had anorexia nervosa for a number of years, and she said she saw somewhere that it was possible to recover. And she said, I didn't know that was possible, so I thought I'd come in for treatment. And she did very well.
Wow.
So actually having a recovery-focused service, examples of people who have recovered, absolutely critical. It gives people a goal and a target to look towards.
The research that you're doing, could it lead to early intervention?
Yes, we're very keen on early intervention because we think that obviously prevents a lot of suffering, and particularly when children and adolescents have something like anorexia nervosa, it can actually cause serious physical problems which may then haunt them as adults, and we don't want that to happen. And it causes a lot of suffering to the families. So we actually have set up a partnership with Headspace here in Adelaide, which is, again, quite innovative, for early intervention programs to make these services more accessible to people. But we really want to be working with GPs to make them aware much earlier, with schools, so that people don't have this watch and wait, it's just a phase, but that they check it out. Check out if it's a problem or not. Don't just hope it goes away. There's no harm in checking it out. And of course, the child will say, no, everything's okay. But it's like if they had some sort of physical disease and they were saying they're okay, you would still take them to the doctor. You wouldn't wait and see.
Of course. Is it realistic to think that one day in the future we'll be able to see who is more predisposed to things like eating disorders?
Yeah, we're hoping epigenetic work will actually allow us to do a blood test. We want it to be that simple. We've got a PhD currently working on a project to help us develop a risk score from the genetic scanning of the blood. And this is based on the work that we have done with adolescents over the years, where we have acquired a number of blood samples, and we know who developed an eating disorder and who didn't. So we can develop a risk score based on that information. And then it's possible to test people and see if they're likely to develop an eating disorder. It doesn't mean that they will, but if you're likely to, then you need to be thinking about ways to protect yourself, choices you have to make, about not going on extreme diets, about the friends you choose, about your use of social media, and about seeking help early if you feel that you're starting to head in that direction.
That would be pretty significant.
It would be fantastic.
How is the Breakthrough Mental Health Research Foundation supporting your research?
Well, they're doing a wonderful job in supporting our research. I guess there are three main areas that I can think of just off the top of my head. The first is they're offering top-up PhD scholarships in the area of eating disorders. And next year they'll be offering a full PhD scholarship. And that means we've brought in people from interstate and overseas to do PhDs with me in the area of eating disorders. So we're bringing new talent in and we're building up capacity for research and clinical work, because these are people who are training in research and clinical work. The second area is the genetic work that we've been talking about, and in particular the epigenetic work. They helped us actually get our bloods genotyped. They had to go off to the Netherlands, and that wasn't cheap. And so getting that has been a really vital bridge now for the PhD student to work in that area to help us develop what we hope will be that one blood test that will give us the warning signs that people might be susceptible to an eating disorder. The third area is something that's happened quite recently. They've funded some research that we're doing now with children and adolescents. We know that the best treatment now to offer that group is what's called family-based treatment. And it means helping the family unite at home to refeed their child, to stand up to the eating disorder and to be united in the face of that pressure. But the wait lists can be quite long. So we're working to provide families with an online family-based therapy with some guidance, and working with a colleague from Stanford University in the US who's developed the family-based therapy, and he's put it online. So we're hoping to have a look at how feasible this is and how helpful it is, and maybe for some families this might even be sufficient. So it helps us manage a real-world problem of wait lists, and it helps us get help to families much more quickly, and helping, hopefully, to manage that distress a little bit better.
So with the help of Breakthrough, you're making some serious inroads, aren't you?
I think we're making some serious and significant inroads, and it's great to see it equipping young researchers and young clinicians who will be the stars of the future.
Professor Tracey Wade, thank you for your time.
Thank you.
Thank you for joining us as we share these extremely personal and important stories. If you would like to donate to Breakthrough Mental Health Research Foundation, please visit breakthroughfoundation.org.au. If anything spoken about in today's episode has been distressing for you, please contact Mental Health Emergency on 131465. We will have other resources in our show notes. Thank you for joining us. I'm Jess Adamson, and let's all tackle mental health head on.